right, we're gonna be setting up for a canine neuter today. I'm gonna go ahead and get my disposable gown on. Okay. We'll go ahead and shave my patient here. And I do want to note this patient was walked prior to surgery, so we are not going to be expressing the bladder. And this dog will also be receiving a scrotal ablation, so we're going to make sure to shave the entirety of the scrotum as well. All right, now that I've got my shave markers, I'm going to go ahead and get my vacuum. Okay, we got all the hair off of there. I'm going to go ahead and change my gloves really quick so I don't have hairy gloves. And we're going to do our dirty scrub. So we're going to do this scrub before we go into the OR. I'm going to do my bullseye technique. Okay, so we'll go ahead and throw those away, and then we're going to cover it with a clean Huck towel, sterile Huck towel here. All right, and then we're prepared to move into surgery in just one moment. All right, we're going to be moving into the OR now. We're going over to OR 3. Okay. We're going to transfer transfer him to the OR table to get him prepped. One, two, three. There we go. All right, and while Rachel is getting him hooked up here, I'm gonna go ahead and get him positioned down here for his neuter. And then we're gonna get a couple of leashes here. I'm gonna put that there, make a nice soft loop here. And then we'll wrap it down just to secure the leg in place for the surgeon. Okay. We'll make sure he's nice and straight up here. And get him hooked up to everything. Perfect. Let me get these front legs tied up here too, just in case. Okay. Just one more leash here. We'll get this other front leg up here. There we go. All right, so we're nice and straight. We've got our legs strapped down. We are attached to the anesthesia machine, and I'm gonna go ahead and get scrubbed. So, for our hospital, we scrub with sterile gloves, and we have sterile bowls here as well. So I'm gonna go ahead and get my sterile bowl opened. All right, so go ahead and put our first sterile glove on. And I'm going to use this to open the sterile bowl completely. Making sure I've got enough sterile gauze in either bowl. And then I'm going to take my chlorhexidine solution, pour it in there, as well as opening up my saline bottle, my sterile saline. Keeping this hand nice and sterile, not touching anything that is not considered sterile. Now that that has the stuff in there, I'm gonna go ahead and put my other sterile glove on. All right. We'll head over to our patient here. And from here, we'll go ahead and get that huck towel off. And then we're going to take this hand to pull out scrub, transfer it to this one, and start the bullseye method. This dog is also having a gastropexy, which is why his abdomen is also shaved. And I'm gonna be going all the way up. Okay, and we'll drop that in the trash. And again, take this hand, move it to this one. gonna do one more, so we'll have at least 3. I'm just gonna go in one more time just to make sure I've got all the disinfectant off. Okay. And we're all set to get draped in.